I'm sure you've heard the news about the cruise ship outbreak. It's been making headlines around the world, and for good reason. Cruise ships are often seen as floating paradises, places where people from all walks of life come together to relax, explore new destinations, and enjoy the open sea. But sometimes these floating cities can become the centre of unexpected health emergencies. In this case, what started as a routine voyage quickly turned into a global health concern, drawing the attention of health officials, the media, and worried families everywhere. 3 lives lost and travellers evacuated. People are worried. The atmosphere at the port was tense as emergency teams worked around the clock to ensure everyone's safety. Families waited for news, some in tears, others anxiously checking their phones for updates. The sight of ambulances and health officials in protective gear only heightened the sense of urgency. For many, the idea that a vacation could turn so quickly into a life-threatening situation was both shocking and frightening. The cruise line, local authorities, and international health agencies all scrambled to respond, trying to contain the outbreak and prevent further tragedy. But is there reason for alarm? Let's break down what we know. Hantavirus is a disease carried by rodents, especially certain species of mice and rats. Unlike some other viruses, it doesn't spread from person to person in most cases. Instead, you usually catch it by breathing in dust that's been contaminated with rodent urine, droppings, or saliva. This can happen in places where rodents have nested or left their waste behind, like storage rooms, basements, or in rare cases, even on cruise ships if proper sanitation isn't maintained. The virus particles can become airborne when disturbed, making it easy to inhale them without even realizing it. That's why rodent control and cleanliness are so important, especially in places where large groups of people gather. The symptoms of hantavirus infection can be deceptive at first. It often starts off with what feels like a regular flu: fever, muscle aches, fatigue, headaches, and sometimes chills. But unlike the common cold or flu, hantavirus can quickly turn serious. Within a few days, patients may develop severe shortness of breath, coughing and chest pain as the virus begins to affect the lungs. In some cases, it can also impact the kidneys, leading to dangerous complications. The illness can progress rapidly, and without prompt medical attention, it can be fatal. That's why early recognition and supportive care are so critical. Doctors and nurses work tirelessly to monitor patients, provide oxygen and manage symptoms, but there's no specific antiviral treatment for hantavirus yet. The recent outbreak involved the Andes strain of hantavirus, which is particularly concerning because, unlike other strains, it can sometimes spread from person to person through close contact. This outbreak occurred on a Dutch cruise ship, leading to several confirmed cases and, tragically, 3 deaths. The news sent shockwaves through the travel industry and prompted a swift response from health authorities worldwide. The ship was placed under quarantine, and all passengers and crew were screened for symptoms. International experts were called in to investigate how the virus got on board and to prevent further spread. The incident has raised important questions about cruise ship safety, sanitation, and the need for better disease surveillance in the travel industry. In response to the outbreak, the World Health Organization issued a global health alert, urging countries to be vigilant and to strengthen their monitoring of similar cases. Health officials around the world are now working together to track the spread of the virus, share information, and coordinate their response. The WHO has emphasized the importance of early detection, rapid isolation of suspected cases, and thorough investigation of any potential sources of infection. They're also working with cruise lines and travel companies to improve sanitation protocols and educate staff about the risks of rodent-borne diseases. While the situation is serious, it's important to remember that outbreaks like this are rare, and most people are not at risk. Right now, the World Health Organization says the risk to the general public remains low. Most cases of hantavirus occur in specific regions where the virus is known to circulate among local rodent populations. For the vast majority of travelers and cruise ship passengers, the likelihood of encountering the virus is extremely small. The WHO is closely monitoring the situation and will update its guidance if anything changes. In the meantime, they're encouraging people to stay informed, follow basic hygiene practices, and report any unusual symptoms to their healthcare provider, especially if they've recently traveled to affected areas. There's no specific cure for hantavirus infection, but supportive care can make a big difference. This means treating the symptoms, providing oxygen and fluids, and closely monitoring patients for any signs of complications. In severe cases, patients may need to be admitted to intensive care units, where they can receive advanced respiratory support. The key is to catch the illness early and to provide the best possible care while the body fights off the virus. Researchers are working hard to develop better treatments and, hopefully, a vaccine in the future. Until then, prevention and early intervention remain our best tools. So, what can you do to protect yourself and your loved ones? The most important step is to avoid contact with rodents and their droppings. This means sealing up any holes or cracks in your home where rodents could enter, keeping food stored in rodent-proof containers, and cleaning up any areas where you see signs of rodent activity. If you need to clean up a space that might be contaminated, always wear gloves and a mask and avoid sweeping or vacuuming, which can stir up dust. Instead, use a disinfectant and wet cleaning methods to safely remove any droppings or nesting materials. If you're traveling, especially to areas where hantavirus is known to occur, be extra cautious in cabins, lodges, or other places that might attract rodents. And if you work in pest control, cleaning, or maintenance, make sure you're following all recommended safety guidelines. Public health officials are also stepping up their efforts to keep communities safe. They're providing safety advice, organizing outreach events, and distributing information about how to prevent rodent-borne diseases. Schools, workplaces, and community centers are being encouraged to educate people about the risks and the steps they can take to protect themselves. The media is playing an important role in spreading accurate information and dispelling myths. By working together, we can reduce the risk of future outbreaks and keep our communities healthy. Stay alert, not alarmed. Prevention works, and for most people, the risk remains very low. It's natural to feel concerned when you hear about outbreaks like this, but remember that simple precautions can go a long way. By staying informed, practicing good hygiene, and supporting public health efforts, we can all do our part to stop the spread of hantavirus and other infectious diseases. The world is watching, and together we can rise to the challenge. Stay safe, stay smart, and keep looking out for one another.